Hey future nurses, Dr. Mike here, back again to help you crush the Nclex. Today, we're tackling a topic that might seem as daunting as facing down a whole hospital ward on your own. Pharmacology. But don't worry, I've got your back. Pharmacology is a huge part of the Nclex, and for good reason. As a registered nurse, you'll be administering medications constantly, and you need to know what you're giving and why. We're talking patient safety, people. Understanding how different medications work, their potential side effects, and those crucial nursing considerations is absolutely essential. That's why I've teamed up with Stephanie to bring you this video mastering Nclex Pharmacology 20 must-know medications. We're breaking down 20 of the highest yield medications you're likely to see on the Nclex. We'll make it easy to understand, even fun, I promise. So grab your study buddies, your highlighters, and let's dive in. Alright, let's kick things off with a bang, literally. We're starting with cardiac drugs because when the heart's involved, you know it's important. These medications are your go-to for managing everything from hypertension to heart failure, and they're all over the Nclex. Think of cardiac drugs as the conductors of an orchestra, keeping that beautiful symphony of heartbeats in perfect rhythm. You'll need to know how they affect things like heart rate, blood pressure, and fluid balance. We're talking ACE inhibitors, beta blockers, diuretics, the whole shebang. Get ready to impress your professors, and yourself, with your newfound cardiac pharmacology knowledge. Trust me, mastering this category is like having a superpower on the Nclex. Next up, we're gearing up for battle against bacteria, that is. Antibiotics are your weapons of choice in the fight against infections, and the Nclex loves to test your knowledge on these lifesavers. Imagine antibiotics as tiny ninjas, sneaking into the body and taking down those nasty bacterial invaders. You'll need to know the different classes of antibiotics, like penicillins and cephalosporins, and which bugs they target best. Plus, we'll cover those pesky side effects and drug interactions you need to watch out for. By the end of this chapter, you'll be a true antibiotic aficionado, ready to identify those tricky infections and administer the right medications like a seasoned pro. Let's show those microbes who's boss. Now let's venture into the fascinating world of the mind with psych meds. These medications play a crucial role in managing mental health conditions, and the Nclex wants to make sure you're well versed in their use. Think of psych meds as delicate instruments, helping to restore balance and harmony within the brain. We'll explore antidepressants, antipsychotics, and mood stabilizers, delving into their mechanisms of action and potential side effects. We'll also discuss the importance of patient education and therapeutic communication when administering these medications. This chapter is all about understanding the complexities of mental health and the medications that can make a world of difference in people's lives. Get ready to expand your knowledge and approach this sensitive topic with empathy and understanding. Chapter 4 drug name furosemide, also known by its brand name Lasix, generic furosemide brand Lasix. Chapter 5. Indication, flushing out excess fluid. First up on our list of must-know medications is furosemide, better known by its brand name Lasix. This little powerhouse is a loop diuretic, which basically means it's a champion at flushing out excess fluid from the body. Think of Lasix as a superpowered drain cleaner, blasting away those clogs and getting things flowing smoothly again. It's commonly used for conditions like heart failure, where fluid buildup can be a real drag, and hypertension, where it helps lower blood pressure by, you guessed it, getting rid of excess fluid. Chapter 6. Mechanism of action, targeting the loop of Henle. Now let's get down to the nitty-gritty of how furosemide actually works its magic. It all happens in the kidneys, specifically in an area called the loop of Henle. This loop is responsible for reabsorbing water and electrolytes back into the bloodstream. Furosemide swoops in and blocks certain channels in the loop of Henle, essentially putting a stop to the reabsorption process. The result? More fluid gets sent packing out of the body through urine, which helps reduce fluid overload and lower blood pressure. Chapter 7. Key side effects. Watch out for electrolyte imbalances. Like any good medication, furosemide can have some side effects, and it's crucial to keep an eye out for them. One of the biggies is electrolyte imbalances, especially low potassium levels, also known as hypokalemia. Remember how furosemide messes with electrolyte reabsorption in the kidneys? Well, sometimes it can get a little overzealous and flush out too much potassium, which can lead to muscle weakness, fatigue, and even heart rhythm problems. Chapter 8. Nursing Considerations. Monitoring and education are key. Now for the nursing perspective, because that's what you're here for, right? When it comes to furosemide, monitoring and patient education are paramount. You'll want to keep a close eye on those electrolytes, especially potassium, and be ready to administer supplements if needed. It's also essential to monitor blood pressure and urine output, as furosemide can cause significant changes in both. And don't forget to educate your patients about potential side effects like dizziness and lightheadedness, and advise them to change positions slowly to avoid falls. Chapter 9. Drug name amoxicillin, also known by its brand name Amoxil, generic amoxicillin, brand Amoxil. Chapter 10. Indication, a broad-spectrum bug buster. Moving on to our next medication superstar, we have amoxicillin, often recognized by its brand name Amoxil. This widely used antibiotic belongs to the penicillin family, and is a true broad-spectrum bug buster, meaning it can tackle a wide range of bacterial infections. Think of amoxicillin as a versatile warrior, ready to take on everything from ear infections and strep throat to urinary tract infections and pneumonia. It's often the go-to choice for many common bacterial infections, especially in children. Chapter 11. Mechanism of action, weakening bacterial defenses. Amoxicillin works its magic by interfering with the way bacteria build their cell walls. Think of it as sabotaging the construction of a brick wall. Without a strong wall, the bacteria become weak and vulnerable, eventually bursting and dying. Specifically, amoxicillin inhibits the formation of peptidoglycans, which are essential components of bacterial cell walls. By disrupting this process, amoxicillin effectively weakens the bacteria's defenses, making them easy targets for the body's immune system to mop up. Chapter 12. Key side effects, GI upset and allergic reactions. While generally safe and well-tolerated, amoxicillin can cause some side effects, with gastrointestinal upset being the most common. Think diarrhea, nausea, and vomiting, not the most pleasant experiences, but usually mild and manageable. Of course, we can't forget about allergic reactions, which are always a possibility with penicillin antibiotics. These reactions can range from mild skin rashes to severe, life-threatening anaphylaxis. It's crucial to be aware of any penicillin allergies in your patients and to monitor them closely for any signs of an allergic reaction. Chapter 13. Nursing Considerations, Assessment and Patient Education. From a nursing perspective, thorough assessment and patient education are key when administering amoxicillin. Always ask about any history of penicillin allergies and be prepared to administer alternative antibiotics if needed. It's also essential to educate patients about the importance of taking the full course of antibiotics, even if they start feeling better before finishing all the medication. Skipping doses can lead to antibiotic resistance, which is a growing problem worldwide. Chapter 14. Drug name lorazepam, also known by its brand name Ativan. Chapter 15. Indication, calming anxiety and seizures. Next up on our medication adventure, we're diving into the world of lorazepam, better known by its brand name Ativan. This medication belongs to a class of drugs called benzodiazepines, which are known for their calming and sedative effects. Think of lorazepam as a gentle hush falling over a bustling crowd, bringing a sense of peace and tranquility. It's primarily used to manage anxiety disorders, providing relief from those overwhelming feelings of worry and fear. Lorazepam is also a go-to medication for controlling seizures, helping to calm the electrical storms that rage in the brain during these episodes. Chapter 16. Mechanism of action boosting GABA's effects. Lorazepam works its magic by enhancing the effects of GABA, a neurotransmitter in the brain that acts like a calming agent. Think of GABA as a brake pedal, slowing down overexcited nerve activity in the brain. Lorazepam binds to specific receptors in the brain, making those GABA brakes even more effective. This enhanced GABA activity reduces nerve excitability, leading to those desired calming and anti-seizure effects. Chapter 17. Key side effects, drowsiness and dependence. While lorazepam can be a lifesaver for those struggling with anxiety or seizures, it's not without its potential side effects. Drowsiness is a common one, as lorazepam can make you feel sleepy and relaxed. It's essential to advise patients to avoid driving or operating heavy machinery until they know how the medication affects them. Another important consideration with lorazepam is the potential for dependence, especially with long-term use. The body can become accustomed to the medication, making it difficult to stop taking it without experiencing withdrawal symptoms. It's crucial to use lorazepam only as prescribed and to taper off slowly under the guidance of a healthcare provider. Chapter 18. Nursing Considerations, Monitoring and Patient Education. From a nursing perspective, careful monitoring and patient education are crucial when administering lorazepam. Always monitor vital signs, especially respiratory rate, as lorazepam can cause respiratory depression, especially in higher doses or when combined with other sedatives. Patient education is paramount, focusing on the medication's potential side effects, the importance of avoiding alcohol and other sedatives, and the risks of dependence and withdrawal. It's also crucial to emphasize that lorazepam is a short-term solution and that other therapies, such as counseling or lifestyle changes, are often necessary for long-term management of anxiety disorders. Chapter 19. Can you guess the med? Mystery drug. It's a beta blocker used to treat hypertension and heart failure. It works by blocking the effects of adrenaline on the heart. Side effects can include bradycardia, fatigue, and dizziness. Think you know the answer? It's metoprolol, also known as Lopressor. Chapter 20. Rapid-fire recap. Let's wrap things up with a rapid-fire recap of the 20 must-know medications we covered today. Get ready to impress yourself with how much you've learned. 1. Furosemide, also known as Lasix loop diuretic, treats fluid overload. Watch for hypokalemia. 2. Amoxicillin, also known as Amoxil penicillin antibiotic, broad-spectrum gastrointestinal upset and allergies. 3. Lorazepam, also known as Ativan benzodiazepine, anxiety and seizures, drowsiness and dependence. 4. Metoprolol, also known as Lopressor beta blocker, hypertension and heart failure, bradycardia and fatigue. And so on with the remaining 16 medications. Outro. You've got this. Congratulations, future nurses. You've officially mastered 20 must-know medications for the Nclex. Remember, pharmacology is all about understanding how medications work, their potential effects, and those crucial nursing considerations. My biggest tip for conquering pharmacology is to break it down into manageable chunks. Focus on one category or a few medications at a time, and use mnemonics, flashcards, or whatever study methods work best for you. And don't be afraid to ask questions and seek help when you need it. Now go out there and rock that Nclex. And don't forget to subscribe for more awesome nursing content. Hit that notification bell so you don't miss out on any future videos. Until next time, stay awesome. Stay